lateral tongue. Those are super important things to remember. So we're going to start with cancer types. So there are four main types I just wanted to cover really quick. Carcinoma would be where the tissue origin or the cancer arises in epithelial tissue. Sarcoma is where the cancer arises in mesenchymal tissue or connective tissue. Leukemia is where the cancer originates in blood, and lymphoma in lymphatic tissue. And let's just do a quick review of cancer stages. So dysplasia is referring to precancer. Carcinoma in situ is the next stage where all of the epithelium is affected. And finally, we have malignant neoplasm, which is a fancy name for cancer. And that's as soon as it invades past the basement membrane, because then it has the potential to spread, invade to connective tissue, and have access to vessels like blood vessels or lymph vessels, and then metastasize and spread quickly around the body. So I have a video on histopathology of cancer where I liken this process to Game of Thrones, and the basement membrane is the wall, and the cancer cells are the evil White Walkers trying to break past. And as soon as they get past the wall, it's all over. So that's kind of how I help to remember that the point of invasion is when we have cancer in the situation. There's also a thing called TNM staging, which is a little outside the scope of this video. It's talking about the stage of tumor invasion, the stage of node involvement, and if there's metastasis or not. But these are the most important cancer stages to remember. Next we have verrucous carcinoma, or first I should say we have verrucous carcinoma. And if you'll remember, we talked about proliferative verrucous leukoplakia, which could be a starting point for this cancer, because you'll notice that it also involves the same two HPV strains that we talked about in the last video. Tobacco can also be a cause for this cancer. It's a slow-growing malignancy, and the treatment would be surgical excision. Now, sometimes it's also called snuff dippers carcinoma due to the direct relation with chewing tobacco. Next, we have squamous cell carcinoma, and it's caused by oncogenes or an activation of tumor suppressor genes, which are pretty much the two most common ways that cancer can form in terms of a biochemical or more genetic level. Increased incidence of oropharyngeal squamous cell carcinoma is associated with HPV 16 and 18, so those same two high-risk HPV strains. The 5-year survival is unfortunately about 50%, and we can also bring in another syndrome. And like I said before, I like to make these kind of like a math equation. Plummer-Vinson syndrome involves mucosal atrophy, like an atrophic tongue, dysphagia, which is difficulty swallowing, and iron deficiency anemia, and an increased risk of oral cancer, like SCC. The treatment for this would be either surgical excision or cancer radiation therapy. Next, we have basal cell carcinoma. Not too much to say here. It's due to sun damage, very rarely metastasizes, and the treatment is usually just a pretty simple surgical excision just to remove the lesion, because it rarely spreads. So basal cell carcinoma, as far as cancers are concerned, is probably one of, if not the least dangerous to get. Oral melanoma is a malignancy involving melanocytes, hence why it has the name. The high-risk sites for intraoral sites are the palate and the gingiva, so those are important to remember for oral melanoma. In the picture here, I have it on gingiva, and this would be an example of an oral melanoma. Usually has this pretty dark, purplish, blackish appearance. The 5-year survival for skin lesions is greater than 65%, but less than 20% for oral lesions. So pretty unfortunately low for oral melanoma.